Hello dear patients, today we are going to talk about the case of combination of several problems related to urological pathology as well as with sexually transmitted infections and even with skin diseases on one and the same penis. So a young man came to us. He had reddenings in the area of foreskin. Secondary to them an erosion developed. It was quite tender. There were also itch and discharges in urethra. There was also whitening of foreskin. It was there for quite a long time. Also there was a difficulty in opening of urethra, development of so-called tightening ring that prevents glans penis from being open. First of all, on observation you can see an ulcer on foreskin, reddening around the ulcer. Lymph nodes were also enlarged and tender on both sides, inguinal lymph nodes in particular. Also there were reddening of urethra and discharges from it. You can see it on one of the pictures. Also you can see whitening of foreskin and phimosis or bad opening of glans penis. Here, just by observing, we can set the diagnosis of phimosis. This is when the foreskin is not sufficient for proper opening of glans penis. Also, by observation, we can set such diagnosis as vitiligo. Vitiligo is one of skin diseases. You can watch a separate, more detailed video about it on our channel. The basis of this disease is an immune response to pigment cells, and in some cases the pigment cells that are laid in skin become the target of immune response on penis, in this case on foreskin. Here an analysis should be taken. This is a culture test for bacteria from ulcer, as this can be streptoderma, streptococcal impetigo. These are analyses for sexually transmitted infections. A standard or a full set is advisable. As a result of such studies, a positive PCR analysis for chlamydia was found and a positive analysis for second type of herpes. So here there is a combination of chlamydia and herpes of second type. If you pay attention, then you'll see that herpetic ulcer is surrounded by quite an extensional reddening, that it is located on the background of quite big diffusion on foreskin. This reddening is ended by white skin of vitiligo. What needs to be done in such cases? From the viewpoint of phimosis and vitiligo, these problems can be left for a later time. Firstly, here we talk about treatment of sexually transmitted infections. For herpes, for the beginning, it's better to prescribe antiherpetic medications by type of Valtrex or Valvir internally, after doing blood analysis for herpes of first and second types. In parallel, the treatment of chlamydiosis takes place with instillations, with injections, with antibiotics according to sensitivity. You can watch a separate video on our channel about the correct treatment of chlamydiosis. Now we are not going to cover it. I'd like to draw your attention to the fact that in this case the problems are solved step by step. Firstly, chlamydiosis has to be treated after taking analysis of smear and blood analysis that I mentioned before. Then attention should be paid at herpes, for healing with a parallel prescription of external medications by type of acyclovir cream, which was done. Then after treatment of chlamydiosis we can do vaccination against herpes genitalis if it did not appear again during this 3 weeks period when a repetitive analysis for chlamydia is taken. If it appeared, then an immunogram is necessary here, as well as a full-scale treatment of herpes genitalis from the immunity point of view. In this particular case, chlamydia and herpes were treated, and then vaccination was done. After that, it is recommended to do circumcision. In this particular patient, it helped to avoid relapses of herpes. It is noted that during circumcision, if relapses of herpes are seen on foreskin, then their frequency can decrease, and it does decrease in particular patients. So it's not always the case that there's only one diagnosis on penis. In this case, there were 4 diagnoses on one and the same penis on one patient. So we often have patients coming to us with several infections or with dermato-urological venerological problems. So So this requires a complex approach and often a gradual treatment of such problems. If it is necessary to diagnose and treat any pathologies in the area of sexual organs, in particular penis, you can consult urologists and venerologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such problems. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.